All right. Good afternoon, and thanks for being here with us at the Central Maryland Public Listening session for our Maryland Commission on Public Health. As Tosin mentioned, we're really excited to be here to hear from you, in particular about ways that Maryland's public health system can be transformed and improved based on your experiences. Our goal is to ensure that all Marylanders reach their best possible health and achieve a lifetime of wellness. Tonight, really, as Tosin is a listening session, and you might hear that a couple of times, beyond what I'm sharing with you just now, we don't have prepared remarks or questions to answer for you, because at this stage, we really are looking to bring input in and hear what your perspectives are from across the state so we can get a broad regional perspective about how public health can be reshaped. For awareness, tonight's session is recorded and will be posted online, and we'll be synthesizing these comments and sharing them with our various commission work groups and commissioners so that they can incorporate this into the recommendations that we ultimately end up making. In terms of public health, I think it's important for us to set a background and say that when we talk about public health, we really mean the whole system of partners and providers throughout. Those folks that come together to ensure that everyone stays safe and healthy. It's a system of prevention, intervention, and maintenance. And oftentimes, public health is so successful in its work that you might not even realize its impact. And contrary to popular belief, the public health system truly is more than just local and state health departments, which this graph helps emphasize, and really that broad nature of the different players in the public health system to ensure that we're addressing all facets of health and create a health in all policies mindset. Over the last 120 years, public health has significantly improved the quality and life expectancy for most Americans. The CDC identified these 10 great achievements recently as leading to measurable improvements in everyday life. Because of things like vaccinations, reducing tobacco dependence, as well as safe food and water, many folks do not experience the deadly disease or outbreaks that used to frequently occur, which sometimes means that individuals can take these achievements and innovations for granted. In that vein, Maryland has achieved many successes in public health and overall has a lot to be proud of. However, like other states, there are still opportunities to improve, particularly in chronic disease measures such as obesity, blood pressure, cholesterol, and diabetes, as shown here. Additionally, mental health and substance use disorder challenges remain top of mind for many as we embark on this work. And in particular, as we heard earlier today in our site visit with me regarding suicide reduction efforts. Additionally, despite this great effort to reduce substance use disorder and overdoses, Maryland only saw a 1.5% reduction in overdose deaths from December 2022 to December 2023, based on preliminary data from the CDC. This is compared to the national average of 3.1% reduction, which demonstrates the need for our work and part of the reason why we are here. Additionally, Maryland's successes have not been universal, and though the gains achieved in public health are great, they've not been shared by all. The Maryland Department of Health Vital Statistics Administration's infant mortality rate report shows that of the 415 infant deaths in 2021, 200 were Black babies. The leading causes of death across all race and ethnicities are attributed to premature birth and low birth weight, which are often preventable or avoidable situations with appropriate support and access to care. Additionally, from MDH's report, similar disparities exist when it comes to maternal mortality rates for women of color, which is one of the reasons that recently the Maryland Department of Health and First Lady Dawn Moore launched a maternal mortality summit to help identify solutions to this challenge, which of course our work will ultimately support and help sustain. Further, Black men have a lower life expectancy at birth compared to their non-Hispanic white and Hispanic male counterparts. These data show that on average, Black men will die approximately 6 years sooner, according to those same data. And despite only making up 12% of the population of Maryland, 32% of COVID-related deaths were identified as Black or African-American individuals, which is clearly a disproportionate share of the population. The commission was created to address these issues and study ways to improve public health for all Marylanders. And we work to break down the barriers between behavioral health and mental health, clinical medicine, and public health systems to ensure that there's holistic access to care and a comprehensive delivery of services. We also understand the importance of environmental well-being as part of that and creating public health in all policies perspective. Our output from this commission will be a report with recommendations that will go on to the legislature and the governor and recommend how to achieve these goals while offering public input throughout the process and ensuring continued engagement going forward. The commission is 16 members, composed of 11 individuals appointed by the governor. There are 3 representatives from the Maryland Department of Health and 2 are appointed by the General Assembly. We have 3 co-chairs, 2 of which are here tonight, as Tosin mentioned. She's one, Dr. Brewster is the other, and Dr. Boris Lushniak is also co-chair but could not be with us tonight. The commission meets monthly in Central Maryland, and we live stream our meetings and record them so you can continue to follow our progress online. And to achieve our statutory goals, we have 5 working groups to conduct research, gather input, and help inform our work throughout the process as we develop recommendations. And those are governance and organizational capabilities, funding, workforce, data and information technology, and communications and public engagement. In total, we have over 130 experts, thought leaders, and other stakeholders who are voluntarily engaged in these work groups and help provide diverse perspectives, lived experiences, and representation. The commission has a short time frame in which to accomplish all of these tasks. Yet this year, we will be launching an assessment and evaluation of the public health system's capabilities. In December, we plan to submit an interim report to the General Assembly and other state partners. And next year, we will conclude our work in the form of a final report and recommendations for improving public health delivery across the state by October of 2025. I won't belabor all the ways that we're collecting data and using existing data sets, except to say that, again, this public listening session is part of one of the many ways that we're doing that, as well as site visits, such as our conversations earlier with Howard County Health Department. We'll also be meeting with key stakeholders and informants to get more in-depth perspective, and of course, leveraging all the existing data that we can find in terms of national data sets and state data. In terms of tonight, again, our primary focus is hearing from you to gather your unique perspectives. Tonight is one of several regional listening sessions across the state. As Tosin mentioned, it is our 3rd. We still have 3 more to go. The next one will be July 30th in Montgomery County. That listening session will actually be held in Rockville, similarly recorded and streamed online. And after that, we will be in Talbot County, August 7th, and we are still working to solidify a date for mid-September for Baltimore City to ensure that we have broad representation and geographic diversity for our regional listening sessions. In terms of what we're hoping to hear from you today, we really want to hear things such as, what do you know and how do you feel about public health? Ways for improving and ensuring that everyone can have the same access and opportunity in public health. What worries or concerns do you have, and what has your experiences been? And similarly, tell us, what does it look like when public health is working best for you? These will ultimately help us get rich perspective on how we can best transform the system and make recommendations. We are asking folks to keep their testimony to about 2 minutes. We will provide a 30-second warning, and after that, if you have additional feedback that you'd like to offer, you can do that in written form. As Tosin mentioned, we're also taking testimony in written form on the commission's website, in addition to what Howard County has collected. That will be actually available through September 30th. And the number, again, that you can call and leave a recorded voice message is 240-654-1301. For more information, for those of you who are in the room, you can scan that QR code or visit us online at this URL, which is a little bit shorter. And again, that is the phone number where you can leave recorded messages. At this point, we are ready to get set up for session. And
talk to my colleague who's far more superior than I do, because I'm a woman of a certain age. Yeah, actually, we can see the people here, and then they can see us. Yep, that way they can see the commissioners and the people. Come back this way.
Excuse me?
Move it
a little bit, yeah. Could we remove the pin so we can see the people who are actually
That's what,
speaking?
yeah, that's what we
Yeah.
were trying to do, so we.
It's on the top left if you hover over. Okay, sorry.
I think you're good. Yep, you're good.
We'll do that. How about that? Rush.
View. Where it says view and then right there.
Yep. Oh, yeah, there we go. And then there's, thank you so much for that. Thank you, AJ. So we can start, I believe there's a list that Shane has of individuals who have signed up, and we can call names and you can give your testimony. So go ahead, thank you.
Great. First up is Anne Schofield. Looks like she's a virtual attendee.
Hi. Hi, yes, I'm online. I've never done this before and I just signed up because I just retired to get more involved in the community. So I think I'm just listening. I'm primarily interested in the hospital capacity in Howard County, and I don't know if that fits with this venue or not. As an aging person, I'm just concerned that we have the capacity that we need for the population. So I don't know if that fits with.
Thank you, Ann. Thank you for joining us. We appreciate you being here this evening with the commission. Thank you.
And if you'd like to speak more about the concerns of hospital capacity, you've got some time left. And
Okay,
we're
as
taking all of that.
as the county has grown and development has occurred, we've had one hospital, and I'm certainly finding friends who have had difficult experiences with long waits in the emergency rooms. As an over 60 person who's never used the hospital, I expect to have to eventually use it, as many people have had to do. And I just think the population has grown and we need another hospital, or quite extensive more capacity at the current hospital. And I don't have a lot of details. I've just been making observations of that. Be curious to understand what the plans are in that regard.
Thank you, Anne.
And that's all I have. Thank you.
Next is Carrie Wargo, also online. Gary, do you want to unmute and share your feedback? We'll circle back. Kevin Strauss.
Hi, everyone. I am online. I didn't realize I was going to be called on today. But I am happy. I was preparing a question. So I'll just read it aloud and then everyone can do with it what they like, right? So here's my statement. I'm hearing an overwhelming focus on physical health. However, the research is quite strong in the past 20 years, showing that emotional health, specifically relationships and connections, trumps all other areas of health for the greatest impact on longevity and quality of life, especially when it comes to preventative care. So what scalable solutions are being considered to improve the public's emotional health, which is different from mental health, especially for families, schools, and businesses?
Great. Anything else you'd like to add?
That's all.
Thank you, Kevin. Next is Tony Eller. Tony, are you on? Misty Harding. Melanie Brown. Deborah Latimer. Come up to the
Oh, no.
I think the microphones are at the seat.
I didn't realize we were talking, but since you asked. So I'm a volunteer with Moms Demand Action for Gun Sense in America. I'm Howard County. And I'm really curious about the new Center for Firearm Violence Prevention and Intervention. That's supposed to be housed, I guess, in the departments of health throughout the state. And I'm wondering how, if that's going to help the health departments focus a little bit more on gun violence prevention, which is something I'm very interested in. And you know what that means practically. I have a degree in public health and social work, so that's why I'm interested.
Ophelia Ross Ott. Erin Ashenhurst.
Hi, this is Erin. I'm glad to attend. This is my first listening session. I'm joining from Accessible Resources for Independence, the Center for Independent Living, reaching people with disabilities in Howard and Anne Arundel County. Really excited to recently do a partnership with the Health Department in Howard County, bringing together a coalition of people with disabilities to identify and address physical and other barriers that people with disabilities in Howard County experience when accessing the health department. Aside from that, generally, we're concerned about access to healthcare for people with disabilities, specifically around transportation resources and emergency planning resources, as well as some of those attitudinal barriers that still exist for people with disabilities in Howard County and beyond. So I would be interested in learning more about how people with disabilities can get involved with planning to address these barriers and how people with disabilities can get access to those resources as well. Thank you.
Thank you, Erin. Diana Moore. Kelly Brandt. Melanie Miller. Marianne McKee. Tashima Ricks. Maribeth Root. Yoon Sun Park. Kirk Rookwood. Bianca Chang. Dana Couch. And Cindy Lee.
Yes. This is a good time to take a break.
We have one number of items.
What's the person's name?
Is that all right? She said she's gonna just.
Yeah.
We still have more on the list.
Oh, I see.
After-
Yeah,
Yes,
okay.
we'll just get them in. For those that joined us after 6 p.m., we have to do this again as part of tradition. Reintroduce, my name is Dr. Olatosun Olateju, one of the commission co-chairs, Commission of Public Health. Thank you for being here today. I want to acknowledge our commissioners and commission support team. We have Dr. Maura Rossman here, one of our commissioners, and also the host, the health officer for Howard County Health Department, where we're having the listening session today. We also have Dr. Mina Brewster, County Exec for St. Mary's County Health Department, and also Commission Co-Chair. We have Dr. Dushankar here, Senior Advisor from University of Maryland. We have Chidabom and Sarah, our support staff on the commission. Thank you for being here. And also want to acknowledge the Howard County Health Department leadership team that are supporting Dr. Maura Rossman. Thank you, Antigone, and thank you, Lisa de Hernandez. For people that are in here, if you are here to give your comment or share your thoughts on how we can improve public health, make sure you sign in. For those that are online, thank you so much for joining. Purpose here today, we're just here for a listening session. Each person has about 2 minutes. Make sure you share your thoughts. We want to hear from you. We'll continue this through 6:30 p.m. For those that are online, you can make sure you submit your written comments on our website. You'll see the form on our website is smchd.org/COPH. We also have a phone line where you can leave an audio recorded message there, and we will get back to it later. The phone number is 240-654-1301. You can leave your message in English or Spanish. We'll continue here. We'll take breaks in between. And at this point, I would like Mr. Shane Atchett to continue the program. Thank you.
Thank you. Joelle Broida. Aisha Brooks.
I'm here. Good evening, everyone. Excuse me, my voice is going. So Aisha Brooks, formerly Mix. I'm a federal public health nurse and an officer in the United States Public Health Service, so a colleague of Dr. Lushniak. So 2 points that I wanted to make today. One is related to the workforce and specifically the public health nurse workforce and understanding what the role of the public health nurse workforce is, the coordination and leadership that's available in the state at each of the county levels. I've had several listening sessions. I served as chief nurse of the Public Health Service and represented the country on a federal level. And in conversations with nurses across Maryland, there was a lack of connection that was described to me in understanding their role and their value. Another issue as it relates to the established nursing workforce board out of University of Maryland, conversations about enumeration of the public health nursing workforce. How do we collect the data to know how many we have in order to determine how many we need? The other part is utilizing the scope and standards of public health nursing practice and how to ensure that the public health nurses are working to the top of their scopes of practice to include roles such as health strategists. Being able to connect the dots across communities that look at the continuum of care and do not focus solely on hospitals, but how we can utilize our skills in order to keep people out of the hospitals. And then lastly, of course, as a public health nurse and a federal active duty deployable asset, emergency management. And how are we coordinating that across the state, but especially at the local level, and looking at communities that are most at risk and that have higher levels of susceptibility following disasters and public health emergencies. And how do we ensure that we're mobilizing our communities so that we can have resiliency and then we can actually be stronger even after disasters and emergencies such as COVID. Thank you. Thanks so much. That's my life's work. That's what I do every day.
Liz Walsh. Mary Carroll. Glenn Schneider.
I'm here. Down. Well, Madam Chair, hello, Commissioners. Thank you all so much. Hello, everybody. I'm Glenn Schneider. I'm the Chief Program Officer at the Horizon Foundation, Howard County's Community Health Foundation. I am also a proud alum of Howard County Health Department. I was the former Planning and Policy Director 13 years ago. I'm excited to be here. I handed out to all of you commissioners, you got a little bit of information about the foundation. I won't go too far into it. Just know that we envision a Howard County free of systemic inequities so that everyone can live abundant and healthy and abundant lives. We also do that by working side by side with community to build power, to advocate for policy and systems change, to dismantle structural racism so that everybody can live a healthier life in Howard County and beyond. So there you go. It's a little bit about us. We are long-term partners with the health department for a very, very long time. We've done a lot of things, everything from physical activity, nutrition to mental health, you name it, we've done it. And I'm excited to talk to you about three things. So using all the time of the people who weren't able to come. First of all, I want to talk a little bit about incentivizing prevention. We don't spend a lot of money on prevention. I think the reason why we don't spend a lot of money on prevention is because we don't incentivize it. Quick story, long time ago, Howard County Health Department created something called the Community Care Team, along with a hospital. And this community care team was out there to really help people who were high utilizers, high cost, and high need. They needed a lot of help. And we created this system around them, the support system that would really help them get the better care that they need. As a result of this work, we saved the system over $1 million. It was about 1.7 million, if I recall. None of that came back into the community. As we think about the AHEAD model that you're all considering for the state, which is a model to really look at how we can do a better job on improving health, maybe this is something that we think about. How do we share risk and share benefit with communities that are investing in prevention so that there's more money to do this afterwards? Because at that point, when we say 1.7 million, it all came and accrued to the state. It didn't accrue to the folks who need it. Two other quick things, can I do it quick? Mental health and maternal child health, there's a lot of activity and movement around it. We should continue. We should think of new funding mechanisms for it. We can't do this without money. Might I suggest public health sort of revenue sources like sugar drink taxes, alcohol taxes, et cetera. And then lastly, a personal thing, not Horizon Foundation, but personal. We have boards of health around this state. We have not utilized them well. We haven't figured out how to strengthen them, make sure that they can do other kinds of work. That's something that you all should consider. Howard County was the first place in the country to pass a regulation to ban tanning beds for young people. We could do a lot more of those sort of things if we utilize the Board of Health Network. Thank you.
Thank you. Thank you so much.
So do we need to admit?
Yeah, let the person in from the waiting room.
Also seen that, Judith Lovecheck.
Yes, thank you. I'd like to certainly agree with some of the people who've already spoken, like Ann Schofield, and someone else spoke about the hospital system and the mental health issues. We all know that there's supposed to be parity between mental health access and physical health access, but I know that having had experiences here in Maryland and also having some therapists in my family, that access to mental health is kind of spotty, probably no worse in Maryland than other places, but the therapists cannot afford to operate their business by relying on insurance without more help with this parity situation. So I don't know if the health department can weigh in on that, but that would be something that would be very beneficial. That I mean, even if we're talking about mental health, I'm sure emotional health would be helped as well. I also want to second the fact that I am an elderly person who had to utilize the emergency room in our one and only hospital, and it was hell. And when I talked to the staff about why is it so awful, they said, and they were nice, the staff were nice, but they said, we just need more than one hospital. So I would second that motion. And there are not enough beds, as you know, and there's staffing issues. And I thought it was just nurse staffing issues, because I've talked with nurses recently, being a utilizer of the healthcare system at my age, and they were feeling grumpy, feeling like underappreciated, overworked, and underpaid. So we do need to do whatever we can to attract a nursing staff and physician staff. I spoke to a physician the other day who works with residents, physicians in training, and they're feeling a little grumpy too, and maybe not being attracted into working with people, because people can be grumpy also. So I think that it was whatever we can do to improve the working situation and the attractiveness. And one of the things, of course, would be that the medical students get out of school and their debt load is enough to make anybody grumpy. So I think those are things that we need to try to do to help the healthcare situation. And then one other thing, I got a phone call the other day from the Maryland Health Department. I was very surprised and pleased, but I had complained to our governor about how dreadful the situation in Maryland is, and this is not a secret, that for a nurse to get a license was an arduous and kind of humiliating experience, very inefficient, and, losing your fingerprints, all this kind of thing. And it took a neighbor of ours who wanted to become a nurse here and is working in New York City now, took her a year to get licensed, to the fact that she never did come here. She's still nursing in New York City. So we're losing good people that way. And I talked to a person who was working in our nursing school and says that the graduating nurses are having dreadful problems trying to get their licenses. So then I learned from the person that called me from the health department that instead of the Maryland Board of Nursing being responsible for that now, and they have kind of a bad rap, now now the health department's in charge. And I don't know when that happened, but I think it would be nice if more people knew that, because it sounds like something is being done to fix the situation. And I think when something is being done and there's being some success, it's really important for the public to learn about that. So if there could be a metric as to how many days after application for a license that license was granted, and show the public how things are much better, I think I would get a lot more support, maybe financially, and also, just support for the health department. And in
Thank you,
general, I
Dr.
just like to
Lubczyk.
say, time is up, okay.
Yes.
Thank you.
Kevin Johnson. Azra Ozturk. Bianca Chang. Maribeth Brute. Okay. Bianca, if you'd like to unmute yourself and offer up to 2 minutes of testimony, we would be willing to receive that. You're still there, Bianca? Lisa, would you like to read the testimony from Amanda's Naricus?
Absolutely. So from Amanda's, it looks like Norakis. She said that we should connect with schools and community and local business leaders, participate in Mental Health Action Day founded by MTV and Paramount. That's all the details she gave.
Try Maribeth group again. Repeat.
Maribeth Brute, would you like to unmute and provide up to 2 minutes of testimony? Is there anyone else online who we've not called on who would like to offer testimony?
Let's see if we're seeing anything in the chat.
Sure. Is there anyone in the room who's not called on who would like to offer testimony? You.
Nothing in the chat at this time.
Okay, great.
So I guess I'm gonna go up here too. And I'm not really, I probably won't make eye contact a ton, but I'll read a little bit.
And if you'll just let us know who you are and if you're representing any group, that'd be helpful.
Okay, so my name is Mary David and I am a resident of Howard County. And I know that most of you probably know that there's a smoke shop on every single corner in the county, probably across the state of Maryland. They sell something there that is, the FDA has named it an opiate, okay, and it's called Kratom. So I understand that the Maryland legislature just passed a bill, HB 1229, called the Kratom Consumer Protection Act. Governor Moore signed it into law, mandate the licensing of Kratom vendors, enforce stringent labeling requirements that clearly disclose psychoactive effects and potential risk, and introduce a permit system for those wishing to sell Kratom. I don't know if anybody knows what Kratom is or not, but I'll let you know what it is. I'm sorry. Okay, so Kratom is a powder ground from the leaves of an indigenous Southeast Asian tree related to the coffee plant. Kratom offers pain relief and mood enhancement similar to prescription painkillers. Advocates say the substance, which does not depress the respiratory system and therefore presents little to no overdose risk, could help reduce the nation's reliance on highly addictive and often deadly prescription painkillers. The growing concern is that prescription painkillers, estimated 3 million to 5 million people are using Kratom and reporting positive results. But worries that the unrelated plant product could be abused for its mild euphoric qualities and users could become addicted are spurring federal officials to issue public health warnings, and handfuls of states and cities have banned Kratom. So Arkansas, Alabama, Indiana, Tennessee, Vermont, Wisconsin, and the District of Columbia have banned Kratom, along with Denver, San Diego, Sarasota, Florida. And it's being considered in Florida, Kentucky, New Hampshire, New Jersey, New York, and North Carolina. Thank you. It is a substance that attaches itself to the same parts of the nerve cell as an opiate painkiller and creates a similar effect in your brain. There was a man that was 7 years sober from alcohol, and he needed some energy, so rather than take a supplement or anything, he took a beverage that was being sold. And it didn't say anything about kratom being in the ingredients. He drank the drink, enjoyed it, stopped drinking it one day, ended up in the hospital with severe withdrawal, and was very ill and is now suing the company who sold the beverage. I think my concern as a resident of Howard County is there are smoke shops everywhere. They're selling kratom. Whether they put an age limit on it or who can sell it or who can't sell it, kids are gonna get it. Adults are gonna get it, and it should not be legal in the state of Maryland. Is that my time?
Yeah.
Thank you.
Is there anyone else in the room who wishes to speak?
I want to.
Hello, I'm Sienna Henry Milton. I came here on official business and I am in no way representing the views of my organization. Don't tell them anything I've said. I want to work there forever. I speak to the commission without knowing anything about your future plans. And I want to say that these listening sessions are great. I think it's amazing to have boots on the ground here in the community. And I think it's also very easy to listen and walk away and do what you want to do. So I think it's just as important as these listening session tours are. Another tour of this is what we did about it sessions would be great as well. I think it's important and truthfully respectful to the people who've come and bared their emotions, bared their concerns, bared their homes in the back of their Zoom cameras, you know. I think they deserve to know that their words are being not only heard, but acted on, if they are. So that's all I have.
For folks online, circling back to see if you'd like to provide testimony yet. Bianca Chang, would you like to unmute and provide feedback? Maribeth Brute, would you like to unmute or provide feedback?
Hello, can you hear me?
Yes, we can. Thank you.
Awesome. I am very sorry. I'm on the way. I'm driving from Rockville to Elkridge, so I apologize if I missed that. I signed up for this trying to listening, but what are you looking really for as a testimony as a resident in Howard County, and what improvements can be made as a health department countywide?
Yeah, essentially, we'd like to know your perspective on how public health can be improved or transformed to better deliver services.
When I think about that, I think about just a few things. One of them is about accessibility to language in terms of equity to the Hispanic Latino community, which is something, it looks like something nuanced here in this area. My background is mostly in public health in Southern California. And then though I've been here for 10 years already. So those are just a few observations in terms of like I said, equity in terms of accessibility to the Hispanic community and language. The other things that I noticed is the transportation. It looks like still is a interesting case in Howard County, and I've seen in other areas in Maryland. So, and that's very tied in to public health because it's just limit the access to like healthcare, for example. It looks like even yes, we know Howard County is very wealthy county, but at the same time, there's still poverty levels. So especially for the low income communities, that's something perhaps just to think about how we can just improve the transportation access. The other thing I'm thinking about is the walkability. Yes, we do have the panel, which are wonderful, by the way. And that makes me like encourage me to walk. But at the same time, there's still many areas that those paths are not safe anymore. So people, they don't feel safe walking through them. And I've seen a lot of people walking by the streets, not using a sidewalk because there's no sidewalk. So, and I've seen, I mean, I read the emails in terms of like areas that the county is improving for walkability, but it's still so many areas. So for example, Elk Ridge is one of them, and even the area on Oakland Mills. So I think that'll be something to think about, what strategies can be used to improve the walkability in this area. So those are my 3 little cents. I apologize again for not just being so timely. Thank you for technology and reception.
No problem. Thank you, Mary Beth. We appreciate your feedback there. Right. Anyone else online or in the room who would like to provide testimony?
I am a resident of Howard County, and if you would permit me, I am not speaking on behalf of the commission, you know, by any means, just as a resident and as a nurse. As we might be aware, workforce continues to be one area that we can strengthen, right? There's so many areas, of course, in our work, but workforce continues to be one issue. If you think about it, it's part of the infrastructure of public health, right? If you have the services, you have the programs, but you don't have the people, right? It's a big burden. And over the years in public health, we've been looking for ways to improve it. You know, there have been different articles that have talked about like improving the pipeline in terms of dedicating funding, right? Funding to improve the pipeline so that when interns and fellows complete their time, the interns that come here to different departments, they don't just go with their talents, right? They don't just go with what they've learned, with their skills. So they stay and they're able to, you know, continue in that path, right? So for them, it's, you know, they continue that work, they have more years of experience. For the health department, it's a win-win, right? Because no knowledge is lost. So I just wanted to, you know, recommend to the commission if it's possible that, you know, part of the recommendations could be to have dedicated funding towards, you know, dedicated funding for interns, right? And fellows, you know, to improve that pipeline. So health departments may be part of their core, you know, funding, you know, whatever the funding is, if there can be a portion of it dedicated to retaining, right? Retaining interns and fellows, I think it would be really, really great. A lot of them want to stay, right? They want to stay, but sadly they have to leave after their time is up because, you know, there's no money, right? You know, funding, you know, it's usually restricted. So I think that's one area. Do I still have some time? I know it's 20 seconds. Okay. The second one is looking at how to, you know, mental health. I think it continues to be an issue. How to have mental health support groups for immigrants and refugees. I know some counties are, you know, they do better in this regard, but you still have some counties that can improve. Immigrants and refugees, a lot of times after they get into the country, you know, they get hooked up with different resources, but a lot of them are dealing with mental health challenges. So I think it's one area that we can also add some funding to, so the local departments can, perhaps they can facilitate this, this effort. Yeah, I think it's one area, mental health for immigrants and refugees. Thanks.
Right, if there are no further comments, I think we can go ahead and draw this to a close. Tosin or Mina, would you like to offer any final remarks, or Dr. Rossman?
No, I just want to thank everyone, both online and in the room. It is standing room only, literally, so that shows the interest at least here in Central Maryland, for taking your time to participate. So I thank you all for that, as hopefully we build a better system for everyone.
And thank you. I echo that sentiment, and also really, again, want to say thank you to the Howard County Health Department and for Howard County for hosting the listening session today. It's really been quite a bit of learning, and we appreciate everybody who's tuned in online or is here in person to offer their remarks. Thank you.
Thank you, everyone. Thank you so much. For those online, thank you. Okay. Our next listening session is going to be at Montgomery County, Rockville, just to reiterate, and it's on July 30th. It's also going to be live stream. Go on our website. Yeah.